Welcome to another episode of Live Well, Move Well, Perform Well. I am super excited today because we have Nicola Marsh here. Nicola is an amazing dietitian that we work with. She is a registered dietitian and head of nutrition at Matt Roberts, working alongside at the intersection of elite performance, metabolic health, and long-term well-being. Alongside her role at Matt Roberts, Nicola works extensively in private practice, supporting athletes and high-performing individuals through injury, rehab, and long-term health optimization. She has particular expertise in injury recovery, nutrition, bone health, Red S, metabolic health, and sustainable weight management. Nicola is known for cutting through nutrition myths and translating complex science into practical, realistic strategies around fueling, protein, hydration, fasting, and supplements. Well, that's quite a bio. Welcome.
Thank you for having me, Simon.
No problems. So, Nicola, we wanted to touch on lots of areas around nutrition, what that means for someone who has had an injury, what it might mean for people who like to fast, what it might mean for people who have bone health issues, be it acute bone health or perhaps osteoporosis, and lots of other aspects in between that, maybe Red S.
Yep.
So, are you okay if we just dive in?
Yeah, let's go for it.
So, when someone gets injured, how do they manage their nutrition? Because nutrition seems to be a little bit of an afterthought during that period at times with some of our athletes or just some of our regular clients. How important is it compared to, say, their rehab program and sort of loading exercise?
Good question. I would agree with you that nutrition can come across as a bit of an afterthought or perhaps overlooked in someone's recovery journey from their injury. And in fact, if we take a step back and think about injury prevention in the first place, nutrition is often underestimated as a method for helping to safeguard the body against illness and injury. So I think it's really important that when we think about that multi-pronged approach when working with an athlete or an active individual, that not only does it include the strength and conditioning, the injury prevention in that program, the sort of multitude of recovery practices someone might engage in, that nutrition is included as part of that. Something that I see commonly when we get into injury is there can be a tendency for someone to restrict their nutrition.
So calorie restrict.
Exactly. So there is a belief often that if I'm moving less as a consequence of injury, I therefore need to compensate by consuming less. And this is the first misconception and myth that I think is of fundamental importance to address when talking about nutrition in injury recovery.
I mean, we see that a lot. We see a lot of patients who assume, particularly ones who are more mindful of their weight, will naturally assume that, well, I'll just cut my calories because they're not able to do their strength training or do their cardio, which in fact is the complete opposite to what they need to do.
Yeah, absolutely. It's a really interesting experience that many patients go through after injury. Their knee-jerk reaction is, I must restrict my nutrition. And that is a narrative that we're fed in mainstream media a lot of the time. If you're moving less, therefore eat less. But the reality is that actually the energy demands for an injured person are very similar to the energy demands of an uninjured active person. And when we look at sort of elite sport, there's some really interesting research around that illustrates this concept. So a few years ago, there was a case study looking at an English Premier League football player. He had had an ACL rupture. He had an ACL surgery after that. And this study used doubly labeled water, which for those of you who don't know is the gold standard for measuring energy expenditure in a free living person. So someone going about their normal life, we can measure their energy expenditure. And what this case study discovered is that the energy output, so the total daily energy expenditure of this injured post-surgical elite athlete, was very similar to the energy output of the uninjured active football players engaging in their normal training program. There was only about a 10% difference. And the researchers put that down to the energy cost of healing and repair.
And being in pain.
Being in pain. but also the demands of the rehabilitation program
Yeah.
would also have an energy cost associated with that. And so actually the difference between the two was not significant.
Yeah.
And that's quite a pivotal paper in helping to illustrate that it is not advantageous to restrict your calories post-injury and post-surgery in particular.
We tend to say to people, look, you potentially need up to 20% more calories and higher sort of protein intake during this period to help that recovery process and that healing process.
Yeah.
Because tissue healing is very energy zapping for the body.
Yeah.
But, are you encouraging people to just eat normally through that period, or are you saying that they should eat a higher calorie intake or more protein? What are your thoughts around that?
Yeah. Difficult to give a blanket recommendation, but certainly an individual assessment is required. For most scenarios, at least no change in energy consumption is required.
Yep.
There may be some circumstances where a moderate reduction may be needed if there is significant immobilization and someone is going to be moving very little. But actually, the reduction is rare. It's usually the same for most cases.
Yep. Okay.
The element that does change specifically is protein, as you've mentioned. And the primary reason for that is because if there is an injury, especially in a limb, that limb is typically immobilized for a period of time. And also there is this process called anabolic resistance, which we also see in the aging population, which means that the muscle does not respond to the stimulus of exercise or nutrition to the same extent. And so
when it's immobilized.
Exactly, post-surgery. And so we need higher protein consumption in order to counter that. So to illustrate the difference, if we think about an athletic population, typically when uninjured and engaging in a normal training program, you might need 1.2 to 2 grams of protein per kilogram per day.
Yep.
That's a broad range, but covers most.
Yeah.
To illustrate...
That's the low end.
That's the low end. To illustrate the increase, it would be around 2.5 to 3 grams of protein per kilogram per day for
Quite a big jump,
injured
actually.
athlete. Yeah. Yeah.
Okay, so perhaps, same levels of calories 95% of the time, unless you've got a marathon runner who's needing to bed rest.
Correct.
But yeah, extreme case. Yet almost you're saying, 1.2 to 2 grams is normal amounts of protein per kilograms per kilo body weight.
Yes.
Yet you're increasing to 2.5 to 3 times.
Yes.
So you're almost, a 50% increase in protein.
Exactly. And that's in order to counter that anabolic resistance. So in an immobilized limb, so for example, if we look at post-ACL surgery, there's a period of immobilization for some athletes. We can see as much as 3 kilogram loss of lean muscle mass in that limb. Yeah. And so that's obviously not going to be in the best interest of an athlete wanting to return to the sport a number of weeks and months down the line. And so in order to counter that loss or to minimize that loss, we need to have adequate protein, and that means compensating for that anabolic resistance. That's why it's that much more.
Anabolic resistance, is that akin to, as we age, we metabolize protein not differently, but slower, and we're not as effective at metabolizing protein? Exactly.
It purely means that the muscle protein synthesis, so the stimulus, the response, the muscle building response we get from 2 stimuluses, either exercise or nutrition, is dampened down. That's called anabolic resistance. And so in order to counter that, it's true in aging and true post-injury, we need more protein than we do when we're younger or when we're uninjured.
And of course, if we're dealing with a lower limb and or upper limb, we see a lot of muscle wastage.
Exactly.
We see, marked atrophy of muscles, which is muscle wastage, and it is tricky and challenging to bring that back. But optimizing protein intake can help to negate that.
Exactly. We're thinking about mitigating loss as best we possibly can and putting that athlete in their best possible position for returning to play.
Okay, cool. So if if someone's rehabbing, we know that there's a bit of a window of optimizing your calorie and perhaps protein intake after exercise. Now, I think I've read so many papers that differ on that,
Yes.
on that, what that window is. But is that the same for, say, a stimulus for exercise? Should we be optimizing that protein intake after their rehab exercises? Or should it be bolus proteins, bits of protein through the day?
Yeah.
What is there a consensus?
It's a really good question. So if we think about in the uninjured athlete,
Yep.
historically and not that long ago, we used to think that an even distribution of protein across the day, around 20 to 40 grams of protein per serving, was the optimal method for stimulating muscle protein synthesis, because there was considered a threshold beyond which more protein wasn't going to stimulate that muscle protein synthesis. But what we now know from the most recent research is that the most important thing when it comes to protein is meeting your total protein requirement in that 24-hour period. So total protein is most important over the timing of protein. But what's important with an injured athlete, if we think about what we were saying a minute ago, their total protein requirement is much higher than an uninjured athlete. And so on a practical level, to try and consume that amount of protein in just 1 or 2 sittings is very, very difficult. So how it translates in practice is the timing of protein becomes important so that somebody can actually consume enough. And so that means eating regular meals, regular snacks. And for a lot of people, it might mean support with protein supplementation.
To ensure that they're getting sufficient protein.
Correct. So protein is a very satiating macronutrient. It slows down gastric emptying, which means food stays in our stomach for longer. And that keeps us feeling full. And that's difficult if you're wanting to consume an adequate amount of protein. So liquid protein can be useful to deliver an easy to digest, high quality protein to meet your full protein needs. And so a lot of people who are injured and have high protein needs will benefit from protein supplementation.
Okay, so you're not averse to the protein shake?
In the right context.
Real food is obviously the best
Food
approach. But, you know, that would mean, as a very well-trained athlete myself, weighing 80 odd kilos, I would potentially need 240 grams of protein per day. That's a lot of salmon, a lot of chicken wings, and a lot of eggs that I would need to try to consume.
Correct. Yes.
So being able to do that over a period of time,
consistently, day in, day out, for a period of weeks,
and supplementing that with some protein shakes, some higher quality protein shakes, would be absolutely appropriate.
Absolutely appropriate, and recommended in order to facilitate that recovery process effectively.
Okay, cool. Okay, interesting. I mean, that's certainly an area that our patients and clients could be much, much hotter on. I think really optimizing that protein, and something we need to push significantly harder, I think, so that their level of understanding is that as well.
Yes, and it's remembering as well that it's not permanent, it's temporary, and it's part of that intervention. So it's viewing that nutrition support as part of the rehabilitation process. It's part of that intervention. And once recovery is achieved and someone's returning to play and returning back to their normal routines, then we adjust again.
You wean that back. Okay, fine. So if we're talking sort of protein, we've got your protein, so we're increasing your protein levels, we're maintaining your calorie intake. What other supplements might be useful for people either in pain or to optimize that healing process? Are there any that you might recommend?
Yeah, supplements is a really interesting topic of conversation, especially when it comes to injury, rehabilitation and recovery. I think it's really important to emphasize that supplements in and of themselves are not the solution, that we need to go food first always. And if there isn't enough energy in the system, supplements won't make any difference. There are certainly some supplements that in a sort of well-rounded, comprehensive nutritional program can be of benefit. So protein supplementation is one, which we've already talked about, the
Yep.
practical implication for that.
Surely vitamin D might fall into
Exactly.
that category.
So vitamin D, whether you're an injured or an uninjured person, vitamin D is of use, particularly this time of year in the UK. It's December now. Anywhere between September to April in the UK, we should all be supplementing with vitamin D. The recommendation for vitamin D in the UK is pretty conservative. It's only 10 micrograms or 400 international units per day.
Which is ridiculous.
And what we see amongst our athletic population, in order to maintain a higher serum level of vitamin D, which is over 100, we need more than that in order to achieve those levels. So what we typically see in our work at Matt Roberts Evolution, we monitor blood test results, we can see what someone's vitamin D is doing, and then we can tailor their vitamin D supplementation accordingly. But certainly for the injured person, vitamin D becomes important, especially in bony injuries, because it helps with the absorption of calcium, and we need that calcium in order to remineralize a fracture or a bony injury. But it's not just limited to vitamin D. There is some evidence to suggest supplements like collagen may be useful in, say, soft tissue injuries, maybe ligament injuries, tendon injuries. And also collagen may be of use in bony injuries because it provides the scaffolding upon which we remineralize the bone.
And
so it's the
what
primary
sort of
protein.
Collagen are we talking about here?
Yeah.
Because there are quite a few varieties.
There are different varieties. You can typically find bovine-sourced collagen or marine-sourced collagen. Sometimes it comes down to personal preference in terms of what that individual is most comfortable consuming. But either of those two would offer the right type of profile to support the type of tissue repair we're talking about today. And there's one other supplement that comes to mind, which is omega-3. There is it's a common recommendation actually amongst the kind of sports nutrition field to use omega-3 supplementation for its anti-inflammatory properties. It might modulate inflammation. It might therefore help to reduce pain. So omega-3 can come from food that we consume, but we can never be totally sure how much is in food that we consume. So
and food types that have omega-3 are your sort of fishy, sort of oily fishes.
Correct. So if you're wanting to consume your omega-3 in its best form, which is its DHEA and EPA form, that comes from oily fish. Other foods are precursors to producing DHEA and EPA, but that conversion is quite poor. So because of that, it's common practice to recommend it in supplemental form as a bit of an insurance policy. You know what you're getting. You know, on that note about knowing what you're getting through supplements, it is really important to be careful when considering what supplements you're taking, especially if you're an athlete. Unfortunately, the regulation and testing processes around supplements is not rigorous. And when you look in the literature, there are varying degrees of contaminants found within supplements that haven't been through that batch testing process. So if you are an athlete and you do go through testing for banned substances, it's in your best interest to do your research. And there is an organisation called Informed Sport that batch tests all supplements. And so if you're looking for a reputable brand that contains what it says it contains and doesn't contain a contaminant or a banned substance, that's the place to go. And that's a good place to go to if you're a non-athlete as well, so that you're buying a high quality.
You know what you're getting, and it's of appropriate quality.
Absolutely, exactly. And the supplement, industry is enormous. And what we tend to see in our clinic, we ask all of our patients to complete a pre-consultation questionnaire before they come. And we're finding that over 70% of our client base are already taking more than one nutritional supplement before they've even been to see us. So it's a common feature of everyone's daily routine. So it's really important that we get to make an informed choice about what we're putting in our bodies.
Cool. What about magnesium? I supplement with magnesium, good for muscle function, good for bone health. Is that useful to take? Often useful for optimizing sleep, potentially?
Yeah, potentially. So I would say that the kind of research field into magnesium is really mixed. There are different kinds of magnesium. There are different ways that you can take magnesium, whether it's in tablet form or spray form or bath salt form. And so they all do slightly different things. From my perspective, for an athlete, if they find that using magnesium in any of those forms offers them some benefit, whether it's real or not, it's still of benefit.
Yeah.
A lot of athletes I work with do find that to be true. From a sleep perspective, my understanding from the literature is that it tends to only be of benefit if there's an existing deficiency. And then if you correct the deficiency with the magnesium supplementation, you're likely to see a sleep enhancement or improvement.
Sleep improvement.
But
yeah.
if there's no deficiency to begin with, then there's
You may not
unlikely
see
to
that
be.
benefit.
Exactly.
Okay. So there's a lot of supplements out there that are very heavily marketed.
There are.
Are those the 4 sort of key base supplements that you would recommend unless you've tested someone and identified that they're deficient in specific areas?
Exactly. What we tend to see a lot of actually in our blood testing is very high levels of vitamin B12. And when we come to assess someone's supplement regime, 9 times out of 10, someone might be taking 2 or 3 supplements that contain very high doses of B12. So the other thing to think about is actually rationalizing your supplements, bringing them all together and going, okay, which of these have overlapping or duplicating ingredients? We see a lot of greens powders on the market at the moment, and they have very high doses of some vitamins, some minerals, and someone might also be taking a multivitamin on the side and also taking, and the overlap can result in excessive consumption of some of these vitamins and minerals.
Yeah. So something to be
Absolutely.
to be watching for. So bone health and injury recovery, we see different types of bone health issues. So we see your bone density issues, which can lead to different sorts of fractures, your insufficiency fracture or your fracture from a standard fall. But we also see our bone stress injuries, which are often overuse type injuries. Are there particular nutritional factors which might lead to really, what's the word I'm trying to say? To really expose people to those type of injuries?
Yes. So bone stress injuries are a common feature amongst the athletic population where there may be underfueling at play.
Yep.
I work a lot with athletes who have had a diagnosis of RED-S.
And RED-S is relative energy
Deficiency.
deficit or deficiency in sport or syndrome?
Technically it's relative energy deficiency in sport, but there are conversations going on in the nutrition and dietetic world about dropping the in sport part. Historically, we used to think that only elite athletes were at risk of developing RED-S or REDS.
Which we know is so not true.
Absolutely not true. And if I think about my entire caseload of individuals that I support with RED-S, in fact, 95% of them are not elite level athletes. They might still be training at high volumes, but they're not professional athletes. They're not engaging in that kind of world. So would it be helpful to define what REDS is? RED-S?
Most definitely, yeah.
So it was around 2014 that the International Olympic Committee actually officially defined it. Prior to that, there was kind of lack of consensus around what exactly it was. So it's a relatively new concept within sports and exercise medicine.
It used to be called female triad.
Yeah, the female athlete triad, exactly. But we now know that this syndrome can affect men in the same way. So we need a definition that's broad enough. And the other reason is the female athlete triad mainly captured the relationship between menstrual function, bone and bone health. But we now know that it actually encompasses a much broader spectrum of systems in the
soft
body.
Tissue injuries.
So for those who are not familiar with it, it essentially is a syndrome or a collection of symptoms of negative health and performance outcomes that happen when someone's exposed to low energy availability. That low energy availability simply means that there is insufficient energy or calories left over in the body after exercise to support normal physiological function. And so every biological process in the body requires energy. It requires calories to function optimally. And the human body has evolved in such a way to always prioritize the delivery of energy to exercise. So we need to take that out of the equation, see what's left. And if there's insufficient energy left, the body is super smart and it down regulates that energy to systems that are not essential for survival. So what we typically see are things like menstrual irregularities. We see a lot of fatigue, a lot of niggles, poor exercise tolerance, poor recovery, and poor sleep, changes in mood, changes in libido, change in immune function, and bony and stress injuries are a really common feature of REDS. And, you know, often someone will present with a bone stress injury as being their first sign, or they believe that's their first sign of REDS, because it's painful and because it holds them back from engaging in the sport that they want to do. But actually there might have been earlier warning signs that were overlooked. You know?
Like the poor sleep, mood changes, perhaps they're getting unwell more frequently than what they usually would do.
And unfortunately, within the sports world, the narrative around period loss as being normal still exists even today. You know, there are a lot of environments where it's considered normal not to have a period or to have
amenorrheic.
Exactly, to be amenorrheic, exactly. And it's not normal not to have a period. So there may be earlier warning signs before a bone stress injury presents
itself. It's
itself.
almost normalised in society, not even just that athletic population to a degree, that you know, a female who might be high achieving within a career, or an executive female who's super busy and travels a lot. Oh, it's okay. I don't have my, I don't have a normal cycle. It's quite irregular, or I don't have a period. So I think that's an issue that you know needs to be addressed with clinicians.
Absolutely, and it's important that the clinicians have the vocabulary and the awareness to know what questions to ask or how to raise that topic of conversation, because it's not always freely volunteered by the individual. There are screening questionnaires that exist that do ask those questions. So if there are clinicians listening and they're wondering about how to go about screening for that, they do exist. There's the LEAF questionnaire. There's a new one called the PEAQ questionnaire.
Nikki Key.
Absolutely, that's hers. Yeah.
The peak one. Yeah.
Yeah.
Okay. Excellent. We have had Nikki Key on here discussing bone health. So you're suggesting that 95% of your population who have clients clients that you see are recreational athletes or train well, and they're the ones rather than the elite athletes.
Yes.
Are these athletes all just continuing to watch their weight, or is it that they're underestimating the demands, the physical demands on their body with work, with life, and then training intensity?
It's a bit of both. So we can often describe low energy availability as happening intentionally or unintentionally. I would say the majority of cases I see, it's actually unintentional, purely due to a lack of awareness, a lack of knowledge around the demands that they're placing on their body. Like you say, through training, but also through maintaining family life and working life and all the other responsibilities that come with being an amateur athlete or a recreational athlete.
It's a hard balance to strike. And we discuss this a lot with our patients who underestimate the physical demands of life.
Yes.
And load and work and emotional stress and what this does and how it zaps energy from the system, because we only have one battery.
Exactly.
That you need to pull, and your body or computer prioritizes resources.
Yes, it's like low battery mode on your phone when that happens. And, when I think about the clients that I work with, they might only view exercise as being that 1 hour that they spend in the gym or the 1 45-minute session that they spend at the track. But maybe they're cycling there and back again. Maybe they're walking to work as well. Maybe they're, going for a run on the weekend and haven't considered that. So it's adding it all up. So that happens unintentionally, and that often is corrected through education, awareness, some careful planning. But there are individuals who are at greater risk of REDS if they're living with an eating disorder or disordered eating. Those individuals who may be restricting their food There may be food rules, there may be a lot of rigidity, but it's ultimately resulting in not enough calories, usually not enough carbohydrate as well.
Yep.
There may be a preoccupation with wanting to maintain a low body weight, and as a consequence, they're living in a state of low energy availability as well.
And are bones more at risk because the computer system prioritizes other systems before the regeneration of our bony tissue?
Yes. Well, bony tissue is a dynamic tissue, isn't it?
Yep.
It's like constantly remodeling.
Yep.
So the body is going to downregulate the distribution of energy to that if it's not considered necessary for survival. Also, we know there's a link with, let's take the female for a moment. The estrogen is protective of bone.
Yep.
And if someone's living in a state of low energy availability and that hypothalamic pituitary ovarian axis has been switched off or reduced and there's less estrogen in the system, that additional protection for the bone is also lost.
Yes.
So that's, I think, why bone is vulnerable in this scenario.
Yeah. Okay. Interesting. And so how can people go about managing this process? Clearly, we need to sometimes pull people back from their exercise load and look at this as an overall equation in terms of how much load they're putting in the system. But a lot of the time, is it just putting a little bit more structure into their eating to make sure that they've got appropriate macronutrients and energy in?
Yep.
Is that right?
Yeah. So everyone's intervention or plan that might come from the diagnosis of REDS looks very different.
Yep.
There are clinical assessment tools that we use in practice to identify what level of risk someone is at, and that will help determine what level of activity they can do.
Yeah.
But it will also determine what level of nutrition support they might require. For some individuals, it can be a really scary thing. It may require an increase in weight as well, which may be the very thing they've spent a lot of time being fearful of. And that weight restoration process can be incredibly difficult and triggering for people to come to terms with. So not only is there a nutrition intervention, psychological support is often needed as well.
Yep.
On a practical level, it often comes down to understanding total needs in terms of energy, carbohydrate, protein, but then also the timing of that in and around exercise. What are you doing before? What are you doing during? What are you doing after? And making sure that we're providing the fuel for the work that's going to be going on during that session. So we break it down in terms of what are their total needs and then also what we call acute fueling strategies as well.
Yep. Okay. So you touched on the fueling strategies there, before and after exercise. Do you see a lot of our patients fast?
Yes.
And will fast for various various needs. I often fast because I feel like it just allows my gut a little bit of a breather and a rest, but not because I'm worried about dropping weight. Yet other people will fast because they feel that it might be appropriate to drop weight. Is this a strategy that some athletes might use with RED-S? And does that expose them to a greater extent if they're training fasted?
Correct, yes. So I can think of a number of cases where I have supported athletes of a recreational level and an elite level where they have read about fasting as being some superior method,
magical approach.
To achieving whatever goal it is.
Team Sky Cycling, 10 years ago, maybe, 12 years ago, they were all about, and there was a push in professional cycling to go out and train fasted with this low carb intake because it thought, okay, it trained the system to be able to adapt to those situations in races. Yet, I mean, that has been completely thrown out the window now to suggest that's almost one of the worst things you can possibly do from a performance point of view.
Yeah, I think that comes from some historical research that looked at kind of at the mitochondrial cellular level, that if there was a period of fasting, you might confer some sort of benefit at that cellular level. and if you're a high performance athlete, Team Sky, you're going to be looking for any performance advantage. But I think what we know now is that when you translate that into performance on the day in real time, it doesn't translate into a performance enhancement. And actually, if we look at kind of what the top cyclists are consuming on rides during races in terms of carbohydrate consumption, it's enormous. Yeah. So the pendulum has kind of swung the other way. But it also comes down to periodization. There may be periods where elite level cyclists are undertaking training low, where they're training in a low carbohydrate state for a specific reason, for a short period of time.
Because they might be trying to cut weight before an event or something like that. Yep.
But it's never going to be as part of that performance race day nutrition plan. Absolutely not.
Yep.
So in the clients that I've seen, fasting has often been a method that someone's tried to do in order to improve their health in some way, or it may be in order to lose weight in some way. And how that's often translated into time-restricted feeding, where someone might reduce the window within which they eat, and often their exercise might fall in the morning, which is when they are fasted. And you're already fasted when you wake up in the morning because you
probably haven't eaten for 8-10 hours.
Exactly.
Yep.
And so we're also noticing in intermittent fasting where somebody might only consume, say, 500 calories 2 days of the week, that again,
That's the 5-2 diet that Dr. Mosley.
Yeah, he was a proponent of that.
Yeah, quite a
absolutely.
Proponent of that,
and what we now know is that it's not just about consuming adequate total calories, it's also about ensuring they are distributed appropriately across the day. And actually,
otherwise, your blood sugar levels are doing this.
And also there are within day calorie deficits. So if you're not consuming sufficient calories around when you're expending calories, we even see problems with bone remodeling at that level.
That particular. Time. Okay. So does that lead? So some of your clients or the data suggests that people who are fasting and then training. Could that potentially expose them to a greater injury risk?
Yes.
Yeah.
Yes.
Okay. So would you ever advocate fasting in someone who is already injured? As a non-nutritionist, I would be like, no, that's not the time to be to be trying to undertake fasting.
Yes.
Because we need a high level of calories, but also sufficient protein.
Correct. Yes, and that is the position that generally it is not a good idea to undertake fasting or any method that elicits a calorie deficit during a period of recovery post-injury. If we think about what we said earlier in terms of the energy demands broadly being the same, as well as the increased protein requirement, any period of fasting is likely to be incompatible with achieving that. So there's never a time when I would actively recommend fasting for someone who is injured and in recovery. If it's something somebody would like to continue with, then it can still be done, but we need to make sure that their total nutritional needs are still met. So it's about
for that day.
Exactly. So it's about removing the calorie deficit element.
If someone has an appropriate calorie intake per day and they do some intermittent fasting, they eat at 6 o'clock in the evening, don't eat again till 12 o'clock the next day. What's that? Sort of 18 hours. Is there a risk that they could still lose muscle with that, even if they had an adequate amount of calorie intake and protein intake?
It's possible. It's possible. Difficult to predict, but it's possible if they're not getting sufficient stimulus enough across the day from repeated protein feeds. It's possible. Okay.
So if someone's trying to optimize muscle health and function, and certainly, if they're injured, we've established that it won't be useful to fast. But if someone's fit, healthy, and just likes fasting, there's still a risk that they may be losing muscle mass.
It's definitely something to monitor. So if somebody wanted to embark on that process, we can go ahead and we can optimize those feeding windows as best we possibly can, and let's see how it goes.
Okay. So if we have potentially more females than males, but maybe not, maybe that's a generalization, who are injured and they are really worried about weight loss, or sorry, weight gain during this period, but we're advocating a higher protein intake plus also normal calorie intake. Is there a safe way for them to try to ensure that they keep their weight level or don't put any weight on? Or, you know, patients often ask, well, can I lose weight during this time? I'm like, that's not the time frame to be focusing on that. We need to focus and optimize the healing environment of your body.
Yeah. It can be very hard for someone to hear that. There is a lot of fear around weight gain. And I would agree with you that injury rehab and recovery is not the time for a weight loss effort. But that can elicit a lot of worry and a lot of concern in somebody. So I would want to spend a lot of time with that person understanding what that's about and what we can do to provide support with that. If there is an approach that they want to undertake in order to, you know, minimize weight gain, you know, absolutely, let's talk about it. But an active weight loss attempt is broadly contraindicated during
that period,
during that recovery period.
And is slightly more, just zooming out a little bit, is weight loss really a simple calorie in needs to be less than calorie out equation? Because in medicine and science, nutrition science is often contradicts itself a lot of the time. And so it's often hard to get a very, very accurate read, or thoughts and processes change over periods. So is that the basis, but everyone's metabolism and how they function is somewhat different?
Yes. So it's a really complicated field. And as you've already sort of alluded to there, nutritional science as a research method is really complex. There are so many interacting and mixed variables at play when we do nutritional research that it's always very difficult to draw really robust conclusions. There are different ways that we can come at it. We can think about it theoretically, that yes, if somebody is consuming fewer calories than their body requires, the theory suggests that weight loss could occur. And for a lot of the population, that is how it goes. That doesn't mean it's straightforward. It's a complex psychological process, behavioral process. For a lot of people, that is how it works. In the work I do, predominantly in the relative energy deficiency in sport field, people can present with REDS with or without any change in their weight, which tells me that it's not as simple as calories in versus calories out. And so my perspective is slightly skewed or adjusted because of that experience in relative energy deficiency in sport.
Okay. So we talk to our patients a lot about the metabolism, their sort of own basal metabolism and the energy consumption of being in pain. But how do pain and sleep and stress interact during perhaps that rehab period to affect someone's metabolism? I mean, that's perhaps a very broad, complex question there, but is there a sense of how they're positive or negatively impacting things?
So if I think about that question from a nutrition standpoint, I can see that pain and food, there's sort of a bi-directional relationship. So, for example, we can eat in such a way that might modulate pain. So if we're eating in such a way that is anti-inflammatory rather than pro-inflammatory, you could go some way in order to reduce or not to exacerbate pain during that injury process, recovery process.
Can you just touch on what you mean by an anti-inflammatory diet rather than a pro-inflammatory diet?
Yes. So there's no sort of universal definition of exactly what that looks like, but there are a collection of foods and behaviors around food that promote an anti-inflammatory environment versus a pro-inflammatory environment. it's often reminiscent of like a Mediterranean style diet. It's one that's low in industrialized sweet and savory foods. It's rich in minimally processed foods, whole food ingredients, lots of plant-based ingredients like fruits, vegetables, nuts, seeds, beans, legumes, that kind of thing. Lean protein sources, oily fish, some dairy, that's what makes up a sort of anti-inflammatory approach.
Okay, cool.
Whereas a pro-inflammatory approach might be typically what we describe as like a junk food diet. Maybe it's rich
Highly
in
processed
highly
food.
processed food, industrialized sweet and savory snacks, fizzy drinks, that kind of thing.
Yep.
And so in that bidirectional relationship, food can help to modulate pain. But pain can also influence how we interact with food. So what I see a lot in clinic is that when someone's in a lot of pain, it can result in a loss of appetite. And that can make it difficult for somebody to be consuming enough nutrition during that time.
And stress can have that same...
Exactly.
Play that same role as well.
Exactly, yes.
But even some people will be comfort eaters when they're stressed as well.
And that's the other way. So pain and stress may change the way you interact with food, whereby you consume less because of a loss of appetite, but it may also result in consuming more or differently in an attempt to soothe, in an attempt to comfort. And so it's really normal to see those kind of changes in behavior during injury rehabilitation. And so that comes down to, again, discussing the behaviors around food and how that relates to pain. And it's complicated. And sometimes when something's taken away from us, like our ability to exercise and our ability to train,
it's a coping strategy for a lot of people.
That might have been our primary source of joy, and it's taken away. And so that source of joy might spill over onto something else, and that might be in the form of comfort eating. And so that's often a topic of conversation in consultation
so
as well.
Complex area. So in effect, it can definitely have an impact.
Absolutely.
Both to potentially increase your metabolism or increase your appetite, perhaps is a better way of saying it.
Yeah, it could increase appetite or it could decrease appetite. And how someone responds to that pain is entirely unique. Same with stress, same with sleep. If someone is highly stressed, sleeping poorly and in a lot of pain, it's unlikely to have a positive impact on our behaviors around food. So it's really important that we think about those factors when helping someone recover from an injury as well.
Okay, cool. So keeping with the recovery picture, how does hydration sort of influence recovery, pain perception, and our muscle function? Clearly, we need to be hydrated.
Yes.
What's your approach there?
So absolutely, whether you're injured or not injured, being adequately hydrated is always a good idea for lots of different reasons.
What does adequately mean in a practical sense for people?
Good question. So this doesn't necessarily mean drinking all of the time. The best barometer actually of checking if you're adequately hydrated is the color of your urine. It's simple. Often people ask, how much should I be drinking? And the reality is everyone's fluid requirements are different and they change day to day according to the climate, according to how much we're sweating, for example. So the color of your
exercise level,
exactly,
I imagine,
exactly. So the color of your urine is the best barometer, and pale straw colored urine is what we're aiming for. During injury, there is some interesting research around pain perception. Perceiving more pain when you're poorly hydrated, which makes some sense. And also if we think about what hydration is doing in terms of blood volume and helping to move things around the body, being adequately hydrated helps to remove the kind of toxins and waste products away from that injured site.
So your lymphatic system will function
exactly
more efficiently.
And it also brings to it oxygen and nutrients that are needed to repair. So it makes good nutritional sense to think about hydration as part of your recovery strategy as well.
So can you be too hydrated? As in, if you're just drinking water, no salts, no other minerals within water, you can drink too much of that, can't you?
You can. There are scenarios where someone may overconsume just water. We typically see this in extreme exercise scenarios. It can lead to something called hyponatremia, which is where essentially you've diluted the salts in your blood so much just by drinking water alone. And in very severe cases, it can be fatal. It can be very, very dangerous. We don't see that very often. But if someone's participating in extreme sports and they're not...
marathon.
And marathons.
Yeah.
Exactly. It is something to be cautious with. And that's when electrolyte supplementation is indicated.
Yep.
When you are sweating a lot, when you're losing a lot of salts in your sweat. Everyone loses different amounts of salt as well. Some people are salty sweaters, some people are not. So it's a good idea to figure that out. There are places that can assess your sweat rate, can assess your salt losses.
Particularly for athletes who are exercising a lot.
Exactly.
To optimize that,
Yeah. So if you're someone who notices that you have a lot of kind of salty patches on your T-shirt or on your rucksack or something, then that's an indication you're probably a salty sweater and might need to think about taking some electrolytes on board.
So you're a bit salty.
Yes.
Nice. So there's been quite a big fad of a lot of companies coming out with little electrolyte sort of sachets and push to make sure we're all optimizing. What's your view on electrolytes? Is that just useful for exercise and optimizing during exercise, or do we need it at other times?
No. So generally, day to day, when we are sedentary or not moving very much, water is all we need to stay hydrated. The marketing around those electrolyte products would lead us to believe that we need to only be drinking electrolytes or need to be putting it in our fluids every time. That's not the case.
There is one medical group that we sometimes advocate, which is POTS, postural orthostatic tachycardia syndrome.
Yes.
Who struggle
exactly
with changes of position and their blood pressure recalibrating.
Yes, exactly. There are small groups of people who may benefit from extra electrolytes, salts in particular, sodium in the day in order to counter that. For the general population who are not experiencing that, electrolytes are not required day to day. But if you are exercising and losing a lot of sweat, losing a lot of salts through sweating.
So even during your rehab process and recovery process, if you're noticing that you're sweating up, electrolytes might be useful during that period.
Potentially.
Yeah. Okay, cool. Interesting. GLP-1 agonists. You're just taking a sigh. So we're seeing them being a bit of a game changer in medicine because they are quite an amazing drug at helping change people's metabolism, their metabolic health, allowing people who have struggled for various reasons to lose weight and really improving a lot of health markers.
Absolutely.
What's your view on them as a nutritionist? Because my understanding with the GLP-1 agonists is that they're really switching off that appetite hormone, and most people are in a calorie deficit.
Yes. So if we're thinking about their use outside of the injured population, they certainly have a place. Exactly as you've described, many individuals are experiencing life-changing improvements in their health and quality of life and ability to engage in the world in the way that they want to through use of those medications.
So if someone is injured and had been using these, it would be advisable to potentially stop using the GLP-1 agonists for a period of time?
It would definitely be a conversation that would need to be had, especially with the GLP-1 prescriber, to understand whether that time was the right time for them to continue with a GLP-1. If we think about the environment the GLP-1's creating in the body, there is a calorie deficit. And as we talked about earlier, is that going to be in the best interest of the recovery of that injury during that time? Probably
it's
not.
Likely to hinder that healing process in some way.
Yes.
Yeah. And so if we're just thinking broadly about someone who's not necessarily injured and there's a vast percentage of the population who have been using this, could they be at higher risk of well, we know that about 30% of their muscle mass is lost when they're losing weight.
Yes.
The sarcopenia is an issue. Probably bone density as a result of that subtle change in their hormone profile. How's this impacting their sort of nutritional needs and demands?
Yeah, it's a really good question, and it's interesting because we often see similar outcomes when someone undertakes a different kind of weight loss approach. In a calorie controlled or a traditional diet, we do also see muscle loss.
Yep.
We do also see changes in bone health. So the GLP-1 is another method for eliciting a calorie deficit and then seeing weight loss.
Yep.
So
it's not dissimilar to what we would already see.
Yeah.
It's just that we're seeing an enormous volume
Yes.
of it happening
Exactly.
all of a sudden
Yes.
at the moment around the world.
Yes.
Yep.
And when I think about the clients that we see in clinic who are taking a GLP-1, there are a couple of things that we're frequently seeing if the structure or support or management plan isn't appropriate.
Yep.
One of them, like you say, is a loss of muscle mass, which typically translates also into a loss of strength and a reduced exercise performance. And that often comes down to the calorie deficit being significant because of the loss of appetite or significant reduction in food noise and thinking about food, but as a consequence, a loss of protein consumption as well. So we need to be thinking about that. The other thing...
We discussed the absolute necessity for people to have a very structured S&C program, strength and conditioning program during this phase to minimize that weight loss, that muscle mass loss.
That is fundamental. So that strength and conditioning program being well programmed and appropriate for them alongside adequate protein consumption.
Yep.
Just like we were talking about earlier in terms of injury, we need those two in order to counter muscle mass loss.
Yep.
The other thing we're typically seeing, again, which is not unique to GLP-1 interventions, but to any calorie-reduced method, is changes in gut function. We're seeing a lot of constipation, a slower transit of food through the bowel. We're frequently seeing...
For those clients who are taking GLP-1 agonists.
Exactly. So that's also featuring quite a lot in clinic.
Because they're the marked volume loss in food, because they're changing their diet along with that, or they're lacking fiber?
Multiple factors like those. So there's a significant reduction in just total food volume, and so there's just less moving through. There may be a reduction in fiber consumption as well. Fiber is quite bulky, and so if our appetite is low, we might not be consuming high volume foods, and fiber is often part of that picture. Also, there's less energy in the system, and like we see with relative energy deficiency in sport, where constipation often presents, less energy is being distributed to our gastrointestinal tract, and so everything's just slowing down. So that is another factor that we're frequently having to discuss and manage in clinic. And then further on down the line, downstream from that, we're concerned about bone health. A conversation that we often have actually at Matt Roberts Evolution is the preoccupation with weight loss and how it has been around for many decades, and how we're now seeing the downstream effect of that amongst our clientele. Individuals who've tried to maintain a low body weight for much of their life are presenting with osteopenia, osteoporosis. And so it's a complex topic. Yeah.
Okay. But they do appear to be game changing in terms of allowing people to lose weight and improve a lot of other health markers along the way. Do you see, clearly different nutritional demands, but do you have a different approach that you might take with an elite athlete versus just an everyday client for their nutritional needs?
Yes and no. So, if we're talking about injury and we had an injured elite athlete and we had an injured, non-athlete, the principles that we discussed earlier are the same. They apply. It might just be that the total nutritional recommendations are different. So the total energy demands of the elite athlete are likely to be higher than the total energy demands of the non-athlete who's injured. But the principle remains the same because metabolically the same situation has occurred. When it comes to approaches with the non-athlete, you can learn a lot from the elite athlete in terms of mindset in particular.
Yeah.
And that's often central to the conversations that we're having, if helping someone recover from an injury is around, a can-do attitude, focusing on what you can do as opposed to what you can't.
Yeah.
And also coming at your rehabilitation program with the same energy and commitment that you might have come at your training program with.
Yep.
And trying to adopt that mentality from an elite sporting environment to the non-athlete environment can be ever so helpful for people.
Yep. Okay. So essentially it's the same, but you might be tailoring things differently based on the energy demands of the client.
Exactly. The principles are the same, but the kind of absolute numbers and the total output might look different.
But the mindset is perhaps the one takeaway that clients could apply from elite athletes.
Yeah, absolutely.
Yeah. So, Nicola, we've covered a lot, but I wanted to just try and wrap it up with summarizing a couple of little bits for our listeners. And what are the 3 big takeaways that people should really think about when they might have had an injury and they're trying to optimize their nutrition?
So my first recommendation is about energy.
Yep.
Just because you're moving less potentially doesn't mean eating less.
Yep. Okay.
And that comes back to eating regular, nourishing food consistently across the day.
So similar or same sort of calorie intake as what you would usually have with just good wholesome food.
Exactly. More or less, there's absolutely no need to over-restrict or to compensate for that reduction in activity.
Yep. Okay, cool.
So my second principle would be around protein.
Yep.
Up the protein.
Yep.
And again, because your protein requirements are higher, an even distribution of protein across the day is going to make it more practical to get enough into your system. Lean protein sources, those protein sources that are rich in leucine, are the best way to get that muscle protein synthesis going.
Yep.
They're typically from animal sources like your lean meats, also your oily fish.
Chicken, salmon.
Exactly. Eggs, dairy. But if you're vegetarian or vegan, you will still do just as well by having a full complement and a range of different plant-based protein sources.
Yep.
So the priority is up your protein.
By how much? 50% if you know what you were consuming before? Something around that figure?
Something around that. It's going to be really difficult to give you an exact number, but it's going to be an uptick on what you were doing before.
Yep.
It's hard to know because we don't know what baseline someone's coming in at with their protein consumption.
Yep.
But it's prioritizing it and thinking, where is the protein every time you have a meal or snack?
Yes. Yep.
Yep.
That's number 2.
That's number 2. Number 3 is eat the rainbow. So think about colors.
Yep.
So
not that bland beige plate on the table.
So colorful fruits and vegetables, plant-based ingredients, all the different colors offer different vitamins and minerals.
Yep.
They're rich in antioxidant properties, they're anti-inflammatory, so are going to be of great benefit during your recovery.
And is there one thing that you would wish people would stop doing whilst they are injured from a nutrition point of view?
I think it comes back to the energy. It's the over-restriction. It's probably 2 things, relying on supplements rather than food and over-restriction.
Yep. Okay. So, Nicola, super fascinating, and I've learnt a lot tonight. It's been great to have you here and to have a chat. I'm sure the listeners will take away lots of amazing information, but I know we need to educate our clients more on calorie intake and really boosting their protein intake whilst they're injured. So thank you very much for your time.